Hi, folks. I'm Gene McLaughlin. I'd like to welcome you to Old Bridge Outlook with Mayor Owen Henry. On this program, it gives the mayor an opportunity to chat with you about things taking place in the township and to introduce you to people making things in the township. And to that end, we're pleased to introduce our guest today, Karen Tortorici, who is the Municipal Coordinator for the Old Bridge Alliance on Substance Abuse. And Karen, welcome.
Thank you, Gene.
Mayor, it's been a while.
Hello, Gene. Good to see you again. It has been a while.
You. And since last we saw...
It wasn't on purpose.
Pardon?
It wasn't on purpose.
It wasn't on purpose, no. But since last we saw, you had a little repair work done.
Had a new hip installed. I want to thank everyone for their well wishes, their prayers. It worked. I'm pain-free for the first time in like a year and a half.
That's got to be
I got a little giddy in my step, but it's good. It's a great feeling not to have pain when you get up in the morning and not to have to lay down at night because you're in pain.
So I can't even believe it.
Modern medicine is amazing, what they can do nowadays. It was, a new hip.
How was the rehab?
The rehab was a little tough. The first couple of weeks were tough, but it was, like I said before, like a switch went off. I was in pain one day, and the next day the pain went away after about 5 weeks.
That's fantastic. So well, good luck with it.
Again, thank you everyone for wishing me well and being here when I came back.
Okay, good job. Thank you.
Thank you.
Karen, I just introduced you. Substance abuse is sort of your area of expertise. We're going to be talking about a new program here in the township, but first of all, can you give us an idea of where the epidemic is in the township, the opioid epidemic we keep talking about? Where do we stand right now?
Well, I did just speak with Pat D'Onofrio in the police department, and he accesses what's happening in town and our overdoses and, unfortunately, the deaths that follow sometimes. And we are slightly less this year, so I only see that as a positive, that we're moving in the right direction.
Okay, thank you, Karen. Mayor, I know we've talked about it off the air, but we're putting together this new coalition of the hospital, the school board, Dave Cittadino, and the township. Could you give us an overview so people understand?
You know, we all admitted here in Old Bridge and all the towns in New Jersey and all the towns in the country that there is a problem with drug abuse, and especially with the opioids. And whenever you have a problem, you look for ways to solving it. We're getting, taking resources and getting to the people, getting the information they need. And I saw a really good opportunity because we have, Dave has the audience we need to get to, our students and our parents of children. We have a hospital that is expanding with Meridian and Hackensack. So I saw an opportunity now to bring all three of us together, the town, the school board, and the hospital. I approached Dave Cittadino and said, hey, Dave, because the problem was that Karen was 3/4 time. She wasn't really full-time.
Right.
And when you have a problem this big, you need full-time attention. You need the staff. You need the people to get the information out to the people. So we were allowed now, because of that coming together, we were allowed now to, we have the finances and the resources to make Karen full-time. At that position as our coordinator, a substance abuse coordinator. So that's the reason I wanted to get everybody together, get the funds. And with the hospital now, they have the resources, they have the information that our parents need to know.
Yes, sir.
They are the professionals, as we like to say in the group. The medical community has studied this problem. They have the answers. And so now we're going to take those answers, we're going to take whatever the hospital has to offer and get it in front of the students and the parents. And and it's also with the county. The county also helps us with Karen's salary. So it's really a four-way.
A four-way deal.
And it's one of the only ones in the state. I can tell you.
I was going to say that. That's
I don't know of any other communities that have taken this initiative.
I haven't heard of any, but it might be out there, but I haven't heard.
Right. No, I think it's a very unique initiative. Karen, does this fit comfortably with President Trump's new declaration of a national public emergency?
I feel very much so, because we need a plan. And as the mayor was saying before, we are moving towards a plan. And I think that they just put out a survey in September that we can look at and see what they're doing, and we could follow suit. I think that they have experts researching, as well as we're going to have the hospital, as well as the school is very valuable to us, because we get information from the student assistance counselors and from the student surveys on what's going on in the town. So all that information coming together and maybe following the opiate task force lead could help us move a little bit more towards tackling the epidemic.
Okay. Mayor, one thing on this, with this idea of reducing the addiction issue, How do we cut off the supply of drugs in the township?
Well,
What do
the
we
cutting
do?
off of the supply is
brutal.
is the federal government's
It's brutal,
job.
right.
That's their, when,
Yeah.
we can't stop the supply of drugs
Right.
that come into Old Bridge.
Right.
We're in the center, we're between New York, we're between Philadelphia.
Yes.
So if the local police, I know the state has a task force, we participate in task force. If we cut off the supply, there's another supply
Another
ready
right
to come in.
behind.
And as the president said, none of this material is made in the United States.
Yes,
It's
I
all
know.
made outside the states and it's brought in.
Right.
So the federal government, and I think the president is serious about it now, to take the steps necessary to take this fight, this battle, on the away field, at the away game,
Away game,
as
right.
opposed to us having to play it on the home field all the time.
Okay.
And we've been successful here in Old Bridge of taking material off the streets. We constantly are making arrests, taking goods, but there's a limitless supply
Yeah, it just
of
amazes
narcotics
me. I
out
know.
there.
It just amazes me, which gives you pause too, I'm sure, Karen, huh?
I was very pleased with the public health emergency. I think that other people thought that it should have had a higher status, but I was very pleased with that. I think that they need to, what they're talking about is how they're going to work it all out when it comes to funding, and it only
Right.
sounds positive to my ears because I know that it has to start from the top and work its way down to us.
Right.
I know a couple of the things that the task force says there's going to be required education for healthcare providers, which we've been talking about. We've been trying to reach out at the town forum to the medical community to come in and help us to, let it out to the community so they have a higher. We could break the stigma more when
Right.
I think when the doctors and the nurses and the dentists are coming in, more and more people I think are responding. Another thing that it said that they wanted to try to have training for athletes and the coaches.
Yeah, I thought
and
that was interesting,
That has
yes.
been something that I have been trying to work on a very long time because my big concern is when the children get hurt in high school. I want to see that they're led in the right direction for their pain if they have to have an operation or, because that could be a time that they could get addicted. And, I'm always looking at that age bracket
Yes.
because that 16 to 34 is a very tight, that's where we're getting a lot of overdoses and deaths. So I'm always looking at that age.
Okay. One thing, if I may, the mayor just talked about the overall picture. What is the specific role of each member of this alliance? For instance, start with the hospital. Mayor, you touched on the hospital. Behavioral science programs in the school. Is
To
that what
bring
we're
the
gonna
mental
see?
health part into this, to bring the professional, what they found over the last few years, now that the medical field is into this. I mean, this is a problem that they I hate the word they caused, but they prescribed these medications.
Well, yeah, that's an issue,
They 20, 30 years ago, it was all about pain.
Yes,
and
sir.
then you went to any doctor, I'm in pain, here, take these. And the
Right.
pain went away.
Right.
So I think they've acknowledged the problem now. So their role, the hospital, is to provide us with the information we need, the science that we need. The school, obviously, they're our audience.
Right.
They're our audience. And the township role is to coordinate all this, and that's Karen's role, is to coordinate the distribution of this information. And the township also has the police department.
Right.
So I think each one plays a separate but yet vital role.
Right. Well, that was my next question. Karen, you're going to be sort of the band leader here, huh? You're going to have the baton in your hand. You're going to be bringing all of this together. It seems to me you got a lot of pieces, though. As the mayor said, the hospital is one of them. What is the role of the school? What is the school board of
Dave
Education?
Cittadino, our superintendent of schools,
Yes, ma'am.
has always been on the front line. So that piece, to me, is already in place. So I was thrilled to see that the hospital was coming in because, like the mayor said, that science part, we have a prescription drug monitoring program for the doctors. So I feel with the hospital coming in, more and more doctors will access this database and look back to see if people are, overprescribed, if they have multiple prescriptions and if any of them are unauthorized. So that's a big way to cut the supply as well.
Right.
So when it comes to the school, they're very much involved with trying to get their parents out. Now this year they're talking about mandatory meetings that the parents are already attending.
Yes.
We're going to bring drug and alcohol abuse into there, and prescription drug abuse. So where we have that captive audience, the school is working constantly thinking about different ways that we could get the information. We have to educate the community. The parents are a very big component.
Right, and is there a way, I think, Mayor, we've discussed this in the past too, is there a way to get the parents there? There seem always to be
The
interested
school district has
parents.
been creative, requiring if you want to park on campus, you want to get a parking permit, the parents or an adult have to join you at a meeting where a program is. And now I believe they started it in the middle schools. If you want to attend the 8th grade dance, an adult has to come with you to a meeting where you or an adult will be exposed to what's going on in town, what's available, the programs, and the goal is for prevention, to educate and prevent. Let's not have an addict in our future. Let's nip it in the bud, as they like to say.
Right. Karen, one thing, you will be the coordinator. How do you fit all these pieces together? You have got a large array of people involved here. You've got volunteers, you've got guest speakers, you've got mental health agencies, you've got the recovering addicts themselves. How are you going to coordinate all this movement? How are you going to put these all
I
together?
think that being 23 years here,
Right.
I think that I finally kind of found a way to pull it all together. It's a lot of interaction.
That's what I mean.
We're
Get the right
talking
people in
to
the
each
right
other,
place.
yes.
Yeah.
And like you said, the right people coming in. Right now we have a group of people that care so much, and they're moving forward from the mayor down into the school. Dave Cittadino. Now we have the hospital. We're very lucky to have a hospital here in Old Bridge that will interact with us and give us this information that we need. I see, because there's co-occurring with the mental health and addiction, they'll show us how we could proceed in a better way. We'll tap into their expertise when it comes to the medical field. And my big thing is get more of the doctors involved. Being when the hospital staff sees that they're more involved with the town, I'm hoping that the doctors that are in the hospital will come forward and come to our town forums and get involved with helping us, because we all need to work together in trying to help.
Well, you just touched on one thing. What is the role of the town hall meetings? I know you have these several times a year. What is their role?
Well, Town Forum originally started with the mayor to provide education to the community. In the beginning, it was something, I wouldn't say simple, but the drop box, where take your prescription drugs out of your house, and if you're not using them anymore, bring them to the drop box. Don't let them be around, because we learned from student surveys, which is what I was saying from the schools, that the students were accessing the drugs from their parents and grandparents. And whatever was in the house, whether they were going to a friend's house maybe and getting it from there. So we tried to educate the community on that. We wanted to talk about the 911 and the Good Samaritan law, that if we had a couple of times in the township where a child was overdosing and the friend was afraid to call the police because they thought they would be arrested. So now we're getting that out to the community as much as possible, so the parents know and they could let their kids, if you ever see someone, if you're doing it for safety and for medical reasons, you will never be arrested. The Good Samaritan law will cover you for that. So that's how it really started. Now we're trying to educate the community more and more about talking about like what CVS did, a 5-day prescription. Talk to the community about, be your own advocate, and then show your children that as well, that, if you had surgery and you need to take a pain medication, after 3 to 5 days, move to something else, and also with the doctors, talking about the doctors to talk to their patients, especially when it comes to when a child gets hurt under 25 years old and they wisdom teeth or a sports injury, that there are alternatives. It's not just and to only prescribe 3 days if necessary, and only fill the prescription if you absolutely need it. So these are all the things that we would like to talk to the medical community about, which I'm sure they're learning every day in the newspaper.
Okay, well said,
Yes.
Karen. I want to thank you, and I'm going to ask you to hold your thought for a moment, if you would. Folks, we're getting ready to take a break right now. This is Old Bridge Outlook with Mayor Owen Henry. Today we're talking about a very important topic here in the township, a public health emergency, the opioid epidemic. Please stay with us. We'll be back to discuss this issue greater length.
I'll be right back. Hi. You think you're probably sober?
Yeah.
But you're thinking about taking the back roads home, just in case. If you're probably sober, then why would you do that? Good choice.
Probably okay isn't okay. If you see a warning sign, stop and call a cab, a car, or a friend.
That's a full glass of wine. I'll be chatting you later.
Folks, welcome back to Old Bridge Outlook. Our guest today is Karen Tortorici, who is the coordinator of the Old Bridge Municipal Alliance for Substance Abuse, for the prevention of substance abuse, I should say. Because, Karen, if we can pick up, you touched on some of the prescription monitoring. Is this a township initiative? Is this a statewide
No,
initiative?
this is across the country now.
Across the country now.
Yes, it's going across the country. And besides that, the prescribers are not just doctors, dentists, PAs.
Right.
They're trying to educate them in possibly cutting back on the supply of painkillers when there's a surgery or an incident with
The quantity that they prescribe.
tooth removal, things like that.
Right.
Things that are hot spots where people do get addicted when they're not really realizing that they're going to be. I think they're stepping up the game with having providers, prescribers, doctors explain more to the patient that when they do prescribe the opioid, that it can be addicting. You know, and really clarify that if you take this more than a certain amount of time, you yourself or your child can get addicted.
Mayor?
Yeah, Gene, it's also to prevent in the early stages of addiction. What a person will do will go from doctor to doctor
to shop,
doctor,
huh?
and that's what this is.
Yes,
They're going to
doctor
monitor
shopping.
that patient, the doctor shopping, the pain management centers. That's what the prescription monitoring program is about, to actually track, how much medication is being prescribed to that individual.
Well, that makes good sense, doesn't it, as a first step?
Yeah, and that's at the first steps of addiction, because when the person will try to get the pills illegally in the beginning because they're very relatively inexpensive before they go to the
the
so-called
illegal
black market.
substitutes, right.
Yeah, and the DEA agent went over that. The cost of these pills on the black market are expensive, especially if you need more than 2 or 3 a day.
Okay.
And then that's why the heroin comes in, because they make that available. Very inexpensive. Very inexpensive.
Mayor, if I may, to that point, the whole idea of treating addiction as a medical condition implies, and I think it's going to be working actively toward helping the patients with recovery.
Yes.
Hospital role. Where do these beds come from to put these people into some kind of a recovery program?
There's a
Do
number
we
of
have the beds?
options. There are private institutions, there are state-run institutions, and we hope that opportunity is going to continue to grow here in New Jersey, because there is a lack of beds. If you call up with a problem, well, you got to wait 2-3 days. There's very few places you're going to call, unless you have very, very good insurance, that are going to come and tell you, well, come on down, we can help you right now. So there seems to be, there's just so many people, there's just not enough beds, and we're doing everything here in Old Bridge to make sure that as soon as that person makes that decision that I want help, we need to get them that help. And I think we have that other shared services with Woodbridge Township, where we're
I
in
was
the
going to
hospital.
mention that. Yeah, talk about that a little bit. That's
One
interesting.
of we talked about it early on, where we are in Old Bridge with the success. We've been able to save lives with the Narcan. We've had a number of reversals where people were basically dead, and we brought them back, and that has reduced the deaths we've had in Old Bridge. But we get them to the hospital. And once they come out of it, we're there with people willing to help them, to get them into treatment. Sometimes they say no. Sometimes they say yes. I think it's about 25%. 25% of the people that have given the second or third chance at life have taken it.
I would hope.
And they get the treatment, but we need the beds, and we've been very successful in getting people into treatment as they want it. But you can't force anyone to help themselves, and it's very difficult. Anyone who wants to hurt themselves, it's very difficult to stop them.
You can't stop them from
But we need to
drinking
be
it.
there. We need to be there, and we are. And I said Narcan and our first responders have saved lives.
Mayor, one thing about this program with the Woodbridge Peer Recovery Coach Program, a lot of the counselors are recovering addicts themselves.
Yes, I think the majority of them. So the person waking up and says, you don't know what I'm going through. And the person can look them right back in the face, oh, yes, I do, because I was in that bed one time. And look, you can change. And in my dealings, as I've gone around the country and listened to the Surgeon General has talked about it, it's the only disease that we face in our country that has 100% cure rate. If you follow the program, you will be cured. You can get better. There's no other disease in the country. There's no guarantee with cancer. There's no other disease where they can guarantee 100% cure rate. And this is one of them. Addiction is 100% curable.
Mayor, one thing that strikes me about this program, and I mentioned it to you, Karen, off the air, and that is this seems to be more focused at adults. Is that true? The Woodbridge program? They talk more to adults than to the student body.
I think we don't have teenagers overdosing. It seems 19 to 60, up into 70. I mean, that's been the age bracket here in Old Bridge. I think a lot of the early on, I think they try to live with it for a number of years. They think they can become functioning addicts.
Yes,
I think it's hard. In the case of my family, we have somebody in the early 30s. And they think they're okay.
And they came back.
Yeah, they can deal with it. They're smarter than everybody else. But eventually it catches up to everybody.
I'm sure it does. Karen, one other thing on this, the role that St. Ambrose may play. I see they're putting in a substance abuse facility. The pastor has set aside some special room.
Club Serenity.
Are they going to be part of this program? You would integrate them in?
I would, definitely. I think it's just so wonderful that it will have something right here. I mean, I know that the faith-based community has been very involved, right, Mayor? I would have to say that they have tried their best to supply offer support groups in their facilities. So many times the churches in town are reaching out to the recovered. One thing I wanted to say about the peer recovery program, Jean, was that it's a win-win because these young adults that are coming in as peer coaches and they're being trained, they have to be recovered and they are being trained to come to be, the police officers will call these peer recovery specialists that are trained to come to the emergency room when there's a Narcan save. And when they come, it's a win-win for both because they're by helping someone else, they're helping themselves and they're helping the person because they can relate. Like the mayor said, they're saying right away, I was in your shoes.
Right.
And I know what it's like and I'm recovered, so can you. And it builds hope. And that's what we want to see for the recovering. When it comes to, another way to break down the stigma, St. Ambrose putting Club Serenity in.
Yeah,
it's right here, right smack in the center of town. I was so thrilled to hear it because we do need support and the recovering addicts do need support and the families need support. I always mention Families Against Addiction because sometimes it's the families themselves that are suffering through it and they want to be in a safe place with other families that understand.
Okay, Mayor, do you have anything to add to that? Or?
Well, any organization in town, we're incorporating it into Old Bridge. St. Ambrose, hats off. Great to step forward in the middle of a neighborhood. I know there was some controversy. They're thinking that the drug addicts are going to be standing outside.
Yes.
So we're going to assist them any way we can. We're getting the businesses involved now in town. The Business Alliance we've been talking to them about helping out. With recovering, with jobs, getting jobs for people who want to get back into society.
I think that's so
very
important
important to make somebody a sense of worth
Right.
It's such a dynamic.
It really is.
It's
It
so
really is.
dynamic, Gene, and it's so, it's just disheartening to see.
It is.
And Jean, that does reach out to the children,
Right.
meaning that, I'm saying the teenagers.
Right.
Because that age bracket when they're starting sometimes is that 16, and it's a little hard to get a job. So if they're recovered, we're reaching out to the businesses. Stephen Mackis here at Economic Development is reaching out to the businesses to try to hire them, to give them a job so they have hope that they're going to recover and maybe not fall back. Maybe they have a 1 or 2 time offense and,
Keep it reduced. Right.
keep it in town, let them feel that they could be part of the community and not slide back.
Okay. One thing, Mayor, I think would be remiss if we did not mention the role of the police department,
Yes.
particularly the role of Officer Patrick D'Onofrio.
Community police officer, full
Right.
time.
We had him in recently, Mayor, as you know, trying to prevent this type of thing. outreach.
He's everywhere. He's in the doctor's offices. He's in the dentist's office.
Pharmacist.
The pharmacist. Karen's office. He's in my office.
Yes.
I speak with Patrick almost on a weekly basis.
Do you really?
Getting
School.
follow. He's in the schools. And it's important for a town this size that we have a full-time
I think
community
it's a great
police
concept,
officer.
a great initiative.
Yes.
And he's about education, prevention, treatment. He runs that whole gamut.
He does.
And then on top of that, with the police department, we have the enforcement end of it.
Right.
Yes.
And we continue to enforce the laws here
Yes.
in New Jersey. The chief and I have sat down and said, anyone coming into this building looking for help, we will help them. We will not arrest them. If they are under the influence, if they have a small amount on them, we will help them. They have to know that. The public needs to know if you need help and you have no other place to turn to, come here. And we will make sure you get the help you need.
Okay, and that brings up a good point. Karen, if people do need help, if they want to turn to one of these entities in our coalition, where would they call? Where would they write? What website would they look
Well,
for?
they could always come, like the mayor said, straight to us, to the Municipal Alliance office, to the mayor's office. Plenty of times people have come into the mayor would refer them to me
Okay.
or whoever is available that day to help them. We have resources in my office where
could I
we
just
can
have
go.
one,
Sure.
Karen, maybe we can just hold it up?
And it's both. It's mental health services and alcohol, tobacco, and other drugs directory. And we keep it, believe it or not, the phone numbers change constantly.
I'm
so
sure
we're
they do.
trying, that's another way Pat and I, D'Onofrio, work together because we can't believe how fast the phone numbers change. So we want the most updated phone numbers to help them. The thing that I tell them the first time, always, when they call my office, is if they have medical insurance, that's the first person that they should call, because that'll start them on a road that maybe through their medical coverage that they
Right.
could get the right treatment. But if not, we have a backup for them. We know that
you have
some
the
people do
referral
not have medical
programs.
coverage, yes. We can refer them the best we can. We also work with Wellspring in East Brunswick. They're very, very involved with the county. Also, I work under the Governor's Council on Alcoholism and Drug Dependence. They also help us too. That's their phone number here. So you're going straight to the county and they have a plethora of information there to help. So we're trying to reach out and provide as much resources to them and the most updated information for them.
Okay,
And the
well,
state has
thank
just
you.
launched a massive program. If you're
Right.
watching TV,
I am watching
it doesn't
all
go,
the time, yeah.
5 minutes where you don't see, Governor Christie
Yes.
telling you to call this number if you need help.
Reach New Jersey.
Reach New Jersey. Yeah. So that should be your first call. Make a few phone calls.
Okay.
Call if you really want help. And I get a lot of parents who want help for their children.
Yes.
The children, they realize that what's happened. Their eyes have opened up. Now they need help. And those are the people who contact me, and we try to get them in the right direction.
Okay, well, Karen, I see the time is up. I want to thank you very much for coming in today.
Thank
I
you
want to
for
wish you the
having me,
very
Gene.
best of luck in your new enterprise.
Thank you,
I'm sure
Gene.
you'll be successful. And Mayor, congratulations on managing to put all this together with all these
We're going
diverse
to keep trying,
personalities.
Gene.
Thank
Whatever
you,
it
Mayor.
takes, whatever it takes. And stay tuned. There's going to be a lot more coming here in Old Bridge.
Well, that's what I was going to suggest, Karen.
Yes.
Station's always here. Come on in frequently. If you have to deliver a message, you want to reinforce what you said today, please.
Thank you, Gene.
Come back anytime, okay? And folks, this has been Old Bridge Outlook for this time. I'm Gene McLaughlin. I want to thank you for watching. We hope we gave you a lot of information today on drug addiction, on drug recovery programs. Look at the bulletin board for the websites and the telephone numbers to call. This program will be on Channel 15. Obviously, it will also be on YouTube. So do take advantage. If you or if one of you are friends or addicted, take advantage of these resources here in the township. There's no excuse, if you're looking to recover, that you don't take some action to do that. Thanks again for watching. I'm Gene McLaughlin. We'll see you next time. Take care.